What if I told you that I saved more lives in a parking lot than in the operating room? Would you believe me? Would you say, Ayla, what were the circumstances that found you there? It was exactly 3 years ago this month that our lives were changed from COVID. But African Americans were disproportionately impacted more than other groups. The narrative was that they were unhealthy and that they had chronic health conditions. But at home, as I sheltered in place, people called me and said, Ayla, I think I have COVID. I went to the ER, they turned me away. I went to the hospital, I can't get a test. And then I would get on the phone, call the ER and say, you turned away Mr. Johnson. He meets criteria. I'm so sorry, Dr. Stanford. I'll get on it right away. As I did that every day, every person had COVID. And so the narrative was chronic health condition, but what I knew is that it was access, access, and access. And so why I was in the parking lot was because of health inequality and because what I knew needed to be done, we put into action. Drexel then came out and said there was more disease in poorer communities, but all of the testing and the resources were in affluent communities. Again, pointing to the access. And so when I say we saved lives, as we tested, remember, in the armamentarium back then, all you had was a test and contact tracing. There was no antiviral. There were no vaccinations. So when you tested, you could isolate, you could get supportive care. When you contact traced it, they could quarantine. You could let your friends know. You could reduce the spread. And so when the infections went down, the hospitalizations reduced, the deaths decreased, and that is how we saved lives. Let me preface by saying I am a surgeon. I trained for 18 years after I graduated from high school at 17 to operate on premature infants whose circulating blood volume is smaller than a 12-ounce bottle of water, to remove diseased gallbladders and cancer from people's bodies. But in this moment, everything that I had learned from my lived experience, from being a medical student, said to me that it was more important that we be out serving the most vulnerable, which is what you do in a public health emergency, because I could not allow one more person to be uneducated, to be untested, or be unvaccinated when I knew that there was something that I could do. So my goal, in short, was to eradicate health disparities, strive for health equity, and achieve health justice. But let me take you back. In 1930, some of us were born, some of us were not. There was a practice called redlining. And not everyone knows about that, but what it in essence meant is that we had these maps across the United States. This historical map is Philadelphia in Camden. And it's the Homeowners Loan Corporation to identify neighborhoods where investments were discouraged. And not only were they discouraged, but in the 1970s, that's when the red maps were found. So for 40 years, no one knew about redlining. They just knew that communities were racially segregated, but not how or why. Federal housing policies, and these were laws, pushed Black Americans into urban housing projects. And then the federally funded loans they were unable to receive to leave those communities. In addition, the Federal Housing Administration subsidized builders. So if you put a 4-lane highway in between a Black and a white community, you were incentivized for that. If you built a wall that prevented the undesirables, the poor, the people of color, from going into the affluent white communities, you were encouraged to do that. Most middle-class families in the United States gain there, and it's missing their wealth from equity in their homes. The majority of school district funding comes from local property taxes and real estate taxes. Many of you may not know, but just in February of 2023, it was ruled unconstitutional, the funding into the Pennsylvania schools, because the majority of the funding that comes from the state goes to wealthy, affluent community schools, and less money goes to the poorer community schools, which, remember, has fewer home ownership because of federally practiced practices. So, wealth is linked to home ownership. Home ownership is linked to education. Education is linked to health outcomes, and health outcomes are exacerbated by racial injustice. This is from Nature magazine. Some of you scientists will know this is one of our most revered medical journals. And this was just 2 years ago that they published this, as COVID was shining this bright light on health disparities, showing that your household income predicted how long you lived. So now we've got the color of your skin, how much money you make, and your school and quality of your school. And then this just came out, and I'm giving you all recent data. I don't have to go 200 years ago. February 2023, this study came out in California measuring births and women who died during childbirth. A rich Black woman and her child are more likely to die in childbirth than a poor white woman in this country. A rich Black woman is 2 times more likely to die and her child than a rich white woman. It's not biology. It's not income. It is the color of a person's skin and systemic injustice that lead to the health disparities that exist in our country. So again, I'm honing in. Wealth is linked to home ownership, which was precluded predominantly by redlining. Home ownership is linked to education. It's why you see some schools with no resources at all and others with a multitude of resources. Education is linked to health outcomes, and health outcomes are all exacerbated by racial injustice. It is why we built a Center for Health Equity in this red line community of North Philadelphia that I showed you on the map, so that we can slowly start to chip away at the health inequities that we did not create, but that we are part and parcel to curing, because we can do that together. So as I was in medical school, I'm learning about social determinants of health, and this Secretary Heckler, who was one of our secretaries of health, and the social determinants of health, and I want you to look at this. This is the definition of healthy people: environments where people are born, live, learn, work, play, and worship. And what are they? Education, which I told you how education is funded. Hospitals and healthcare access, which again, builders were incentivized not to build in the community. And if you tried to get a loan in a zip code that was redlined, the lending companies would not lend to you, which is why you don't see health entities in these communities. The same with the grocery stores. It's why you can't find fresh produce in these communities. Also, the economic instability or lack of stability that dictates the health outcomes in a community. It's why you see check cashing places and no banks in these red line communities. And then the Heckler report, I think I was in high school, comes out, and Secretary Heckler says, there are health disparities in this country that are based on the color of a person's skin, that if you are born here, you will not live as long and your health will not be as good. And out of that came the Office of Minority Health, one of the National Institutes of Health whose mission is to eradicate health disparities. This was in 1985. And the Hegler report showed, because white women have the highest life expectancy and Black men have the lowest life expectancy, this disparity of 10 to 20 years based on your gender, the color of your skin, and again, your zip code. And I wish I could tell you that this map from 1985 is different in 2023, but it is not. So on April 3rd, 2020, and I can't believe it's April 1st, 2023, 3 years ago, when this came out in the Philadelphia Tribune and said that African Americans accounted for more than a third of the death, I was not believing it was their chronic health condition. I was not believing that it was because they were unhealthy. I knew it was because they needed the access, because again, all we had was a test. I bring this here to remind me of the countless people I cared for, but on one particular day, a gentleman came to us, 75 years old, and a caretaker at a funeral home. He spent all of his days picking up bodies, and then having gravesite funerals because you couldn't embalm and you couldn't care for the deceased the way you used to in the midst of COVID. He went to a location to get a test, but because that was not his hospital, because he did not have a prescription, he was denied a test. He was 75 years old. He was a Black man. But the checkbox, the algorithm, precluded him from getting a COVID test, even though he was exposed to coronavirus every single day and people who had died from COVID. When he came to us and we cared for him, he sobbed in our arms because we were giving him the access he was trying to get, and then asked us, would we also test his son, even though he was younger? And of course we said yes. But this is what I mean when I talk about the inequities and why we stepped into place. That first slide I showed you was April 3rd, 2020. This one was April 17th. So it took us 2 weeks to get together because we knew what needed to happen. And we went to those red line communities. We went to the Black church where we knew people trusted. We called ourselves the Black Doctors COVID-19 Consortium because we knew of the untrustworthiness of the healthcare system in our country, that by seeing a face that reflected the people we served, that people would come to us. It was all intentional because at the time, this was the group who was most impacted and most vulnerable and was losing lives at a rate 3 times greater than white Americans, and they needed us in the city. So why does this matter to you? In 2050, 27 years from now, would you be surprised to know that half of the United States population will be, more than half, will be people of color? Are we ready for that? It takes much more money to take care of a sick person than it does preventative care to keep them from getting that sick in the first place. Do we have enough providers that reflect the populations that are most in need? And why don't we? Why are there only 5% Black doctors in this country? And when I graduated from medical school in 1997, guess what? There were 5% Black doctors, and it has not changed. I would say to you, it's not about the talent pool. So my 5 steps towards health equity. you have to acknowledge bias. First, we have to recognize that health disparities exist, that health inequities are prevalent and are here right in the United States of America. Then you have to believe that the reason why they exist is because of prior historical beliefs and systemic injustices that were not right, that we continue to propagate today. Then you identify, what can I do as a student? What can I do as a lawyer, as a hairdresser, as a sanitation worker? What can I do to help eradicate health disparities so we can live longer? For me, I was a physician. And yes, I trained 18 years to be in the operating room, but in that moment, as a native Philadelphian, born in North Philadelphia, when my family and friends and church members called and said, "We need you," I knew I was more valuable in the parking lot than in the OR. So I identified where I needed to be. And then you act. You do something. We have had hundreds of years of research. The Office of Minority Health has been around since 1985. And you know how I know the NIH works? Because we are all in this room, most of us unmasked, when 3 years ago, we were in the worst pandemic in our history. Because we're curing cancer. Because in the 1980s, when people had AIDS and HIV, they died within a year. Now people are living 10, 20, 30, 40 years and not even transmitting the virus. That's how I know the National Institutes of Health works. Why isn't it working for health inequity? As you act, and we were just doing the work, these phenomenal, altruistic volunteers who were not getting paid. We did not have huge institutional funding and federal and state backing. We did not. We just knew it needed to be done. And the next thing you know, you find out that you're outpacing the health department, the hospitals, the entities that have been here for hundreds of years because you did it on purpose. And then you share the information. You share what worked. You share what didn't work so you don't do it again. And then you repeat it. And here, sharing the information, we're learning that the work we did as a grassroots level in 2 weeks of it being reported, that Philadelphia had vaccinated more Black Americans than any other major city in the United States without a huge budget. Just saying that your life matters, and we are here to help you live as long and enjoyable as you can. In my time with you today, this has not been about shame or blame. It's been for us to acknowledge and recognize the health disparities in our nation and know that no, we did not create redlining. We did not create Jim Crow. We did not create the systemic injustice, but what we must recognize is that those practices led to intergenerational wealth for some and intergenerational grief for others. We can no longer say they exist but not act. No longer say they exist but not identify what role we play in it. Because at the end of the day, when one of us is healthy, we are all better for it. Thank you so much for your time. Thank you.